Started. Hello. Good evening. I'm Dr. Srinagesh from Ojas Aesthetic, Hyderabad. And today, in the last three sessions, we have spoken about what is lipedema and what do's and don'ts about lipedema and other ways how to diagnose lipedema. Today, we shall be discussing about the management of lipedema, the treatments available for lipedema, so that people can benefit out of it. So, but I'll give a brief about lipedema and then go ahead with the other aspects. Now, lipedema primarily affects women. It is bilaterally symmetrical and affects basically the lower half of the body and sometimes the arms. So, it is a disease of the extremities. So, and it has got a genetic basis. There could be associated pain in the affected areas. There is associated tenderness and easy bruising in the areas, and there is fluid retention in the as the disease progresses. So, because it is seen specifically in women from the time of puberty, it, uh, pregnancy and menopause, and it does not occur primarily in men, and it also has a it runs in the families. It is thought to have a genetic basis and is hormone related. And the common mistakes which people make in diagnosing is they think it's obesity or cellulite or lymphedema, that is accumulation of fluids in the limbs. And as the disease progresses, the quality of life gets affected. Lipedema is occurs with very peculiar uneven distribution of fat in the buttocks, thighs, legs, or arms, and has a rather even distribution across the body. Now, most of the people are not diagnosed correctly with of lipedema because this particular disease, though identified in 1940, has not been entered and classified as a disease by WHO until 2019, and is not taught in the medical colleges. So the awareness, even in the medical fraternity, is not very good. So a lot of education has to be taken place, not only from the general public but also amongst the doctors and healthcare personnel. So now, if you look at obesity and uh, lipedema, there's a difference, because you see, if you look at the normal fat looks bright yellow and shiny, whereas lipedema fat looks dull, nodular, and like globules and blobs of fat under the skin. Now, the typical symptoms of lipedema are swelling occurring from the hips to thighs and the legs, and the feet and the wrists are spared, are not affected, and the affected areas are generally soft and spongy, and the skin is cooler than usual. There is easy bruising in the affected areas, and there may be, in the affected areas you might find a lot of spider veins, especially over the unusual fatty deposits. You find spider veins, and surrounding areas you may also find varicose veins, and the legs and other parts may become heavy. They may start hurting. They may be swelling. By in the morning it'll be okay, but by afternoon or evening it could be, or in hot weather it could be painful and uncomfortable. Patients with lipedema may find it very difficult to walk or participate in a lot of physical activities. This is because of restriction of mobility, because of the unusual deposition of fat in the around the joints, especially the knee joints, and this results in low self-esteem and other problems like anxiety, irritability, and restriction of social life. Buying clothes is often very difficult because of the difference in sizes between the upper and lower body. So if a upper body you fit into a size S, the lower body you may have to look for a double XL or a triple XL or an XL. So that's why and lipedema is not seen only in obese people. You can see in all weight ranges. It could be right from grossly overweight to otherwise normal people, or even underweight women also can get and be affected with lipedema. So they'll be very extremely thin, but the lower half of the body, that is the hips, thighs, legs, or the arms, may be unusually large for the frame. So now, if you look at the types of lipedema, you have five types of lipedema. What are those? The first type 1 affects the pelvis, buttocks, and hips. Type 2 affects the buttocks and thighs up to the knees. Type 3, the buttocks, thighs, and the legs up to the ankles are affected. Type 4, the arms are affected. And type 5 is the lower legs, that is the area between the knees to the ankles. They are affected. The feet are spared and they're quite slim and look quite good. Next is, if you look at the stages of lipedema, there are four stages of lipedema. One where the skin and fat is generally quite smooth and soft to touch, and you may find a small nodules or fine granules like substances in between, interlaced between in the fat condition. Stage 2, where the skin becomes a little dimpled and it becomes uneven, and the fat becomes more granular or more nodular, and may even reach the size of small lime or sponge balls. Stage 3, where the fatty depositions are much larger, the skin becomes much more uneven, and there you can also find a lot of skin folds in the thighs and in the legs just above the knee joints, and even under the knee joint over the shin. You might find unusual deposition of fat, and sometimes in these situations the lymphedema starts to set in. So that is accumulation of fluid because of the weakness, inherent weakness of the lymphatic system. The lymphatics, they start kinking, they bend over, they're not able to let the lymph flow easily and freely, and so the lymph leaks out into the surrounding tissues, and the tissues become edematous, and you can have pitting. Then stage 4, where the lipedema as well as lymphedema both coexist. Even the feet becomes large and swollen, and you can pit easily. And in later stages, even the pitting is lost and becomes a non-pitting edema and extremely difficult to manage. The legs become very, very heavy. So now, uh, as we go into the management of lipedema, we have various kinds of modalities of treatment. Diet, you should look into a ketogenic diet. You should look for a low glycemic index diet and avoid high sugars and high glycemic index foods. So more amount of saturated fats in the form of ghee, butter, or coconut oil, and good amount of good quality proteins, be it plant proteins or animal proteins, and sizable and sufficient quantities of vegetables, fresh vegetables and green leafy vegetables is extremely found to be quite useful for alleviating some of the symptoms of lipedema. And if you look at exercise, you have to look into low impact exercises. High impact exercises could be deleterious or have a harmful effect for patients suffering from lipedema because they already have a little bit or some amount of joint mobility problems. So, and there is an inherent weakness of the cartilages and ligaments around the joints, and so high intensity, high impact exercises should be avoided. Low impact exercises like walking, jogging, water exercises, water based exercises, swimming, these are good. Cycling, these should be uh, looked into and done on a regular basis. Then we come into the massages. Massages, is by dry brushing, soft, brushing from the farthest part of the body. We go up to the proximal part of the body. So similar in the arms as well as in the lower limbs. Then comes, massages lymphatic massages, you should also same way go upwards. Then the use of regular use of compression garments. Compression garments like this, you should wear it. Usually, flat knit uh, compression garments would be more preferable and could be worn throughout the day, and can be removed in the evening and with a foot elevation. So that could give a good amount of relief. Next comes, we can go to the therapy room, where you can see the demonstration of a compression pump, lymphatic compression pump, sequential pumping, where first the feet are massaged, then the legs are massaged, then the upper legs, the lower thighs are massaged, and then the upper thigh, is massaged. So once this is done, you can do it. This keeps on repeating. This cycle keeps on repeating for approximately around 20 minutes minimum to half an hour, and both the limbs can be treated at the same time. So once this particular thing is done, you find a good relief of, the fluid starts to flow upwards into the body, and the feet become more relaxed and soft. As lymphedema sets in, the legs tend to become very heavy and, quite turgid. So this turgidity is reduced with this particular process. So yeah, that is how the sleeves are worn, and the pumping starts. That's the pump. Right. So now we come to the medical management of lipedema. The medical management of lipedema, you uh, have to treat according to the signs and symptoms and the condition of the patient. If the pain is too heavy, then we may have to give some amount of analgesics for giving some kind of a relief. Similarly, if the patient is having a lot of edema, then we may need to give a small dose of diuretic, so that the body drains out the excess amount of fluid along with the compression. Then it has been seen that guafenicin helps in patients soft get the lymphedema tissue soft, and also in some patients with lipedema, we find patients are found to have some kind of a relief with guafenicin. So this is another thing. It is in other countries it's called Mucinex. Here, the generic name is guafenicin. So then the best kind of a treatment, if treated early, is a water sparing, lymph sparing, water assisted liposuction or the body jet. This particular procedure, we can just show you a small animated video of that, so that you will understand how the water, the cannula goes into the tissues, and there's a gentle spray of fat, of water into the fatty tissue, and that gentle pressure of uh, water dislodges the fat very gently, without disturbing or harming the lymphatics, the venous system, or the nerves, and extracts the fat out of the body. Can you switch it on, please? Yes. So this is how, through a small little nick, we pass the cannula inside, and when as the cannula goes, it starts hydrating the tissues inside very well with a gentle spray. And this gentle spray is sufficient to dislodge the fat from the collagen, which is onto which it is stuck. You can see that there are small little veins and vessels and other tissues which generally don't get affected, and the fat is simultaneously taken away. The excess water and the fat is taken away, and then the entire tissue collapses. Mind you, you can see that not all fat is removed. Some amount of fat stays back, which cannot be removed, and that is essential for the normal physiology of the body. So now, if you have any of these symptoms, then you could be a likely candidate of lipedema, and the earlier you get onto the treatment, the better for you, because lipedema is a progressive disease and it goes on, and the deposition of fat goes on increasing as long as there is a hormonal imbalance, and as long as this happens, you know, the debility keeps on increasing and the disability keeps on increasing. It is, it doesn't, it is, lipedema has found, patients with lipedema has been found to have uh, a good glucose control. They have a little bit of protection from getting diabetes, hypertension, and cholesterol. But the weight of this particular body, because of the excessive deposition of fat and unusual deposition of fat, has a lot of bearing on the various parts of the body. Now, if you look at the typical difference between lipedema and lymphedema, we'll put up a slide for you, and in that you can see that there is, both the hips, the thighs, and the legs are almost looking equally symmetrical. But in case of lymphedema, you will find that only one limb is affected generally. Sometimes both limbs can also be affected if it's a congenital condition or in rare acquired situations. But if you look at it, the swelling starts from the toes upwards. So this is a typical differentiating factor between lipedema and lymphedema. Then, if you look at the difference between lipedema and obesity, that is the next slide, you find that in a typical lipedema, you find a narrow waist and a large lower body, whereas in obesity, you find the midsection is quite large. So, so that is a differentiating factor between obesity and lipedema. And sometimes you can find both lipedema and lymphedema in the same patient. As lipedema, tissue keeps on growing and you cannot do any more exercise, then fat starts to get deposited even in the waist and the other parts and the trunk. So both of them can be associated. And then if you look at the knee joints, there is a malalignment of the body axis. And can we show up the slide with the malalignment of the legs with the. So when there is a malalignment, when as the fat keeps getting deposited in the thighs, you will find that the axis, the center of gravity shifts. Though it remains the same, but the leg is deviated, the knee joints are deviated, and there is a shift in the uh, positioning of your feet. So the axis is lost, and there is a differential strain on the knee joint. So the cartilage gets eroded. The inner side of the cartilage gets eroded early than the outer side. And this particular erosion, the differential erosion, thins down the cartilage and almost up to the bare bone. And when the bone of the thigh bone and the leg bone, they start to touch each other and come closer, then you have excruciating kind of pain. That is what is called arthritis. And to prevent this arthritis, if an early liposuction, there have been studies, innumerable amount of studies, especially in Germany, by Dr. Joseph Stutz, who has found that liposuction of the thighs and some parts of the legs can realign the legs into a more normal position and help in build up the cartilage and prevention of destruction of the cartilage and protect the knee joints. And you can also avoid or postpone a knee replacement for a pretty long time. So you can walk on your own 2 feet on legs and on original joints and not on implants. But if you look at the next slide, the lipedema progression due to incorrect loading of the weight on the joints results in massive joint degeneration. And this is just a 39-year-old lady. So, the basic reason for our education is to come to a conclusion on the proper diagnosis, get properly managed, take the necessary precautions, and take the right kind of a treatment and precautions to lead a comfortable life. So, if you look at the next slide, this is a change you can see in the leg alignment after liposuction of the thighs. So if you look at the grid and see the position of your feet, the heel, you can see that you fall into a straight line. And the next slide, you can see the difference before and after one session of uh, water assisted liposuction using the body jet equipment. And this is the next one also is uh, before and after two sessions of uh, treatment. Thank you. So now, summarizing, we find that lipedema is a medical condition affecting the primarily women and characterized by painful swellings of the hips, thighs, legs, buttocks, and sometimes the arms. The lipedema occurs in due to abnormal deposition of fat under the skin, and it usually starts at puberty. It could The trigger points are puberty, pregnancy, and menopause, or any gynecological surgeries, stressful gynecological surgeries. It is seen to run in families, and there is a familial predisposition, and so it is thought to be genetically predisposed because it starts somewhere around puberty, and it also increases and during pregnancy and menopause. It is thought to be of has a hormonal because of hormonal imbalance, and estrogen progesterone are some of the culprits. And treatment earlier, the diagnosis done, and earlier you embark on management, the sooner and more comfortable your life is going to be. So thank you. And in case some people, if it keeps progressing and this particular thing, the disease progresses and there's a lot of fatty deposition, you may end up with varicose veins, and you may need to consult a vascular surgeon for treatment and management of the varicose veins. And even if it goes towards lymphedema, also you will also need to take the help of a vascular surgeon to manage lymphedema. Thank you so much.